It's time now for Medical Aesthetics Update. Doctors William Stephanie and Robert DePilla bringing you the latest news in plastic surgery and cosmetic dentistry.
Breast augmentation is very popular, especially in the spring now as everyone tries to get into bathing suit weather. Breast augmentation is making the breast fuller, larger, and giving it more projection. The implants that we use are saline implants. I personally use Mentor implants because they're a little softer, have a better feel for the patient. Breast lift is known as a mastopexy. And there have been quite a few changes within the last 3 or 4 years. We've gone to shorter scars, decreasing the scars and getting the same aesthetic result. We currently also use pain catheters to decrease the amount of discomfort people have. This has revolutionized our practice. Some people even go back to work the next day.
Dr. Stephanie and DePilla, advancing the science of aesthetic medicine. To reach Dr. Stephanie, call 586-779-3030 or go to WXYZ.com. It's time now for Medical Aesthetics Update. Doctors William Stephanie and Robert DePilla bringing you the latest news in plastic surgery and cosmetic dentistry.
There's many different forms of bleaching. There is one that you buy over the counter. There are ones that a dentist can make custom trays for you. And also the Cadillac or the Rolls Royce of bleaching is called power laser bleaching, which is done in a dental office. Within an hour and a half, your teeth are usually between 5 to 7 shades lighter. Veneers are a thin shell of porcelain, which is a laminate that covers the facing of the teeth. This particular patient came in and unfortunately she had some unsightly bonding between her teeth. A couple things that we accomplished. Number one, she has a better bite. The teeth are a lot whiter, and also she has better symmetry and are better balanced.
Dr. Stephanie and DePilla, advancing the science of aesthetic medicine. To reach Dr. DePilla, call 248-646-0442 or go to WXYZ.com. It's time now for Medical Aesthetics Update. Doctors William Stephanie and Robert DePilla bringing you the latest news in plastic surgery and cosmetic dentistry.
Body contouring includes liposuction, abdominoplasty, and body lifts, especially after massive weight loss. The type of liposuction that I use is one of the newer types. It's called power-assisted liposuction, which uses a vibrating handpiece to decrease the amount of trauma to the tissue. With the body contouring, we do use pain pumps to try and decrease the amount of discomfort that people have post-operatively. The problem with abdominoplasty, or the major complication we worry about, is skin slough in the lower abdominal wall. And now with some different techniques and less traumatic techniques, it is a safer procedure, and we can remove more tissue, especially liposuction aspirate, to really change a person's torso completely.
Dr. Stephanie and DePilla, advancing the science of aesthetic medicine. To reach Dr. Stephanie, call 586-779-3030 or go to WXYZ.com. It's time now for Medical Aesthetics Update. Doctors William Stephanie and Robert DePilla bringing you the latest news in plastic surgery and cosmetic dentistry.
Instant orthodontics is a procedure my partners and I developed 10 years ago. When a patient comes in, if they have misshapen, crooked teeth, we can usually place veneers over these teeth, and it's a great elective procedure instead of going through conventional braces. Invisalign is a new technology within the last 5 years in which we make custom formed trays to move teeth as opposed to conventional braces. Some of the benefits of Invisalign is, number one, is it's clear. Number two, it's form fitting to your mouth, and also number three, it's removable. Many adults are using Invisalign as opposed to conventional braces.
Dr. Stephanie and DePilla, advancing the science of aesthetic medicine. To reach Dr. DePilla, call 248-646-0442 or go to WXYZ.com. It's time now for Medical Aesthetics Update. Doctors William Stephanie and Robert DePilla bringing you the latest news in plastic surgery and cosmetic dentistry.
We're going to talk about several ways of a non-invasive way to make your lips look fuller. A procedure that I've been doing for 10 years is called a non-surgical smile lift. This particular procedure involves placing veneers on the teeth. And the way we position the teeth, we can actually make the lips look fuller, wider, and more symmetrical.
The non-surgical approach to lip augmentation or making the lips larger is to use fillers, which are collagen, Restylane, or the patient's own fat. There's no downtime, so that people can go right back to work if they need to.
You're going to get a younger, fresher, and also a rejuvenated look.
You definitely get a brighter smile and a more voluptuous look to your lips.
Doctors Stephanie and DePilla, advancing the science of aesthetic medicine. To find out more, go to WXYZ.com and click on the Medical Aesthetics logo.